Welcome back to the Law Factor Live. In the studio, we have Dr. Owen Gabriel and Rufus Bousquet. We're now going to take your calls, specifically if you want to speak to Rufus about anything that he said right now. And yes, we will be talking to Maurice Muffet as well. So stay tuned to us for that. So if you have any questions for Rufus, because time is running around so quickly, yes, we've seen all your messages. Don't worry about that. We've seen them. I'll go through some of them whilst the calls are coming in. Now, Rufus, you know, a lot of people have actually emailed and said that, you know, wow, you know, brave of you to say certain things. But right at the beginning of the program, you did say that you actually wanted to bring this to the fore because it happens to everything and to every, you know, not to everyone, but to a lot of people who prefer to just keep it inside. Yeah. You know. Now, I just want to ask you a question in terms of the. Did it knock you for six? Because I mean, you spoke about, you know, the election.
Well, I had a few emotional moments.
Yeah.
I mean, I didn't have it.
How would you describe those emotional moments?
The emotional moments were, I think they were, when I started thinking in terms of not being around for my kids. You know, and then it got to the point after you've been diagnosed, where it seems everywhere you turn, you're hearing somebody died of cancer or somebody has cancer, something that probably was happening before, but we weren't paying any attention to it. But of course, you become more aware, you become more sensitized, and so you're always hearing it all around you. And in some cases, it's rather unfortunate because quite a few young people have died of cancer. And so I started doing something which I think was very good for me therapeutically. I started thinking in terms of all the people who died younger than I did. And I said, well, you're doing well. You know, I mean, you've lived to this age. So what are you crying about? You know, just do the best of it with it and just go and, you know, relax your mind, because I really believe stress is a major factor in this particular disease. That's my own belief. I believe stress is perhaps, because, you know, I ate pretty well. I exercised. I mean, you know, I kept myself reasonably trim. I mean, I wasn't a saint in that respect, but I'm not a big drinker. I don't eat in a gluttonous way. I mean, so I took fairly good care of myself. And I know people who are close to me who do a lot of stuff that you know, I pretty much get down on them for very often, and they don't have colon cancer.
Were you upset? Were you upset with yourself that you didn't do anything about the signs sooner?
Yes, I was upset that I didn't go for that colonoscopy, because I would have caught it a lot earlier had I done so. Had I done so in January of last year, I mean, this thing had another 7 months or so that it just grew in my body, you know, and I could have probably avoided that had I been responsible enough to go for it, you know. But I had that certain sense of invincibility too, and you know, this can't really be anything. And I'll also confess one thing to viewers, by way of letting people understand something. There were a lot of taboos about the colonoscopy. I mean, people were saying, boy, this thing is rough and so on. There's nothing difficult about this. I mean, it's simple. It doesn't hurt. I don't think there's any discomfort to it, you know. But of course, Doc, you know, I'm a tough cookie. I mean, I stuck needles in and everything else, and, you know, I'm hanging in there. So at the end of the day, I don't know if it's my own resistance to pain or whatever. But at the end of, I do not think that it is sufficiently uncomfortable that people should be fearful of going and do it. I think you should do it. Men should do it. Women should do it. There are a lot of women who have, you know, succumbed to this as well. So it's not specific to men, but certainly we're discussing men this evening, so of course we'll concentrate on that, but it is something that people should go out there and have themselves checked insofar as that's concerned, because you may catch it as a little polyp, get it out of there, and save yourself a lot of heartache and expense, you know, moving forward.
But doctor, what are the other symptoms perhaps? Because not everyone has the same type of symptoms. What should men be looking for when we're looking at cancer on the whole?
Well, you know, I mean, those cancers that affect men, we spoke about the prostate cancer issues, but as far as the colon cancer is, the fundamental one is that change in your bowel habits. So whether it is that you present with constipation, as you know, you're not as frequent as you used to be, or maybe it's diarrhea, or a combination where it alternates constipation and diarrhea. These are some of the things. In addition to that, abdominal pain might be another symptom that you also get with colorectal cancer. Weight loss is well known to be part of this, and it's significant in most cases. Persons also have loss of appetite, and therefore, you know, they don't consume as much. There are questions of nausea and vomiting. And certainly in advanced stages, you have such situations where there's blood in your stool. So, you know, and those are clearly advanced, you know, where you have obvious blood. In the case where you do a stool test, we're not looking for blood that is visible to the naked eye. We do chemical tests on your stool so that we're able to identify what is called occult blood. So there's mild bleeding in there, but it's an early indication that there's something happening. And if you look at some of the pictures that we've shown, the process of developing colon cancer, if you start from the last picture that we showed earlier on, you know, we know that there are certain pre-malignant lesions that if you do your routine test, if you had that colonoscopy, we'd have been able to diagnose this. And, you know, in some cases there's a polyp. You know, that if you look at that picture that we show there, you see that polyp is one of those things that can lead to a more, you know, a more pronounced type of disease. And if you get it on time and you remove it via the colonoscopy, then, you know, the following picture is the one that really we're looking at. You remove it via the colonoscopy, then you're able to send it to the lab and have it diagnosed, and you may determine an early type of lesion, you know, where that is concerned.
That's so true, because after the operation and everything was done with me, when I did a follow-up colonoscopy, they actually discovered further up in the colon. What was the name of that thing? It was a
dysplastic lesion, a high-grade...
A high-grade dysplastic lesion, which was then removed and tested, etc., all the way around the edges to ensure that they weren't cancerous. But that most certainly would have turned into a cancer had it not been discovered and removed. So it would have been a case where you think you're okay, and then a year from now, all of a sudden, you find that, yep, there's cancer again up somewhere else in the colon. But fortunately, it was discovered. So these are the things that have to be done. You know, there has to be follow-up work in order to make sure.
And it was important that we had done a particular test called a PET-CT.
That's correct.
Which was what was able to differentiate from something that was just suspect to something that we thought was more important and more relevant, that needed an additional colonoscopy. And that's how we were able to identify these lesions in the colon.
Okay.
So, and that's an expensive test.
Yeah, well,
you know.
I was thinking that, but unfortunately we're going to have to go back to the break. And when we come back, we're going to be talking to Maurice Maffat about an alternative way that you could perhaps look at getting your cancer better. Of course, this is The Law Factor Live on DBS. Stay with us. We'll be right back.